Thank you very much. I'm curious, either personally or your organizations, how many patients are there at this point? Because I've heard, meaning, is there one or two? And then follow-up to that is, how do you balance those two? Is there one patient, the mother, or are there two patients, the mother and the baby, from your organization standpoint? Because you mentioned some things about doctors being able to practice based on what they think. Well, if you think there's only one patient, so I'm just curious how many, what does your organization think? Is there one patient or two patients in this situation? And then how does the bill balance those two?
Sure. The TMA is committed to providing the best care possible to the mother and the fetus which she is carrying. That is the nature of who we are as
by calling it a fetus, you're saying there's not a patient there, right? That y'all's position is that's not a patient.
Clarify the question. When you say a patient in the sense of?
Is there one or two patients at time of, in these situations, is there one patient or two patients?
We are committed to taking the best care possible of that mother and that fetus. So if that would
So there's one
qualify,
patient.
if that would qualify as a patient under the definition you're proposing, we would be in support of that. We're absolutely committed to maternal fetal health at every stage of pregnancy, including immediately after delivery and thereafter.
Okay, I didn't think it was a
No.
So there's one patient, according to you? Because
Yes.
to me, that's
No,
what
it's a
we're coming down to in this bill, is trying to figure out where that balance is, and it's really tough. I'm not trying to.
No,
It's a really tough thing because we want to protect both, and we want to favor, I think, most of it, the mother or the one that is there. But if there's, I'm just trying to figure out what responsibility your organization feels like there is to the second. And
So Representative Frank, I might be able to answer the question for you. So in this bill, we put in a new section 170A.022, which is basically what you're asking. So in that case, it says that the obstetrician needs to act in a way that if they're treating a pregnant woman that would sustain the life of the child, unless doing so would provide a negative impact on the risk to the mother, whether death or reasonable bodily injury. So that's a new section in here. It says here, a physician who treats a condition described in 170A.002B2, that's the new definition, or the definition of medical emergency, shall do so in a manner that in the exercise of reasonable medical judgment provides the best opportunity for survival of the unborn child.
Okay.
Unless doing so is a negative impact on the mom.
And the negative impact on the mom,
Is risk of death.
Can that include mental anguish? Can that include?
No, sir.
Okay.
It's risk of death or serious bodily function,
Okay.
which is a physical condition under the current statute, and that contains in this bill.
Okay.
Does that answer your question?
Yeah, it doesn't answer the one or two patients one, but yeah, that answers that question. Thank you. Because I know you use you use plural on patients, but then never talked about the second patient. And I'm done.
When we have a patient in the hospital, we have someone admitted under a name. We don't have the unborn child admitted at that point as a patient, but we consider both until there's this end-of-life care issue, and we consider them both very seriously. Again, we are blessed to have the amendment that offers the exception to clarify that women diagnosed with a major health issue, and that could be cancer, that is going to terminate their life, and they can choose to now receive treatment to terminate the pregnancy if needed to prevent the harm to the mother.
Representative Frank.
Thank you.
Representative Frank, may I also add something to it? I think it's very important for all of us, you members, and everybody in this room, when these situations arise, these are all wanted. This is not a choice bill. It is just to ensure that all of the language is clear when it comes to liability. Like, what am I allowed to do when her life is in danger or her major bodily functions in danger? As Ms. Kaufman stated, we are required by law to take, the physicians are required by law to take any action they can to ensure that, give the opportunity to the unborn child, fetus, whatever your political stance is, to survive. And so I think that's important to remember. And the other thing to remember is hospitals and the physicians that practice in them, they were treating It was a medical standard of care, and they were treating these patients as a result of pregnancy complications. Obviously, the definition of abortion, includes what was happening in hospitals and the physicians making these decisions. That was about 1%. Now, as a result of all of the laws that have gone into place as a result of the Dobbs ruling, the majority of these complications are now happening in hospitals. And so we went from kind of something that you never had to call a lawyer about or anything to you had to make sure, doctors felt the need to make sure that they were acting within the scope. And so that is all we're trying to do today. And I think the law requires us to ensure and take all actions necessary, to protect the unborn child's life, but you are not required to do so if it risks her life or her major bodily functions. I hope that clarifies everything.